Hello, I'm William Huffaker, board certified plastic surgeon with St. Louis Cosmetic Surgery. Today I'd like to discuss with you what we call our mommy makeover procedure. Our mommy makeover procedure is designed because women after pregnancy have some issues. The areas of problems are the breasts, the tummies, and miscellaneous fat deposits, usually the thighs and sometimes around the abdomen and back. With the breasts get larger during pregnancy. After the hormones leave, perhaps after breastfeeding, the volume of the breast goes away and the breasts get almost a deflated appearance. This causes what we commonly call droop, or medically we call ptosis. To correct this, we need to do a breast lift. Sometimes we may be able to get by with just minimal amounts of droop with just a breast augmentation with a breast implant. Normally we'll put that underneath the muscle. We can use saline or we can use silicone. But with the breast lift itself, there are different types. We can take a small ellipse or crescent of tissue just above the areola to just lift the areola upward a little bit. Sometimes the nipple and areola are pointing downwardly, and this just lifts the nipple up a little bit. It is not really a breast lift. It does not lift the breast tissue up. It just helps to centralize that nipple areolar complex. From there we go to incision all the way around the areola. We call this a circumareolar lift, circum for around. And we take a little donut of skin around the areola to make the breast skin smaller. We can raise the nipple areolar complex up a little bit. Plus we make the breast come in a little bit smaller and tighter. And for somebody with just small amounts of droop, this is a very good method of lifting. This can be combined with breast implant alone, as can the crescent or ellipse mastopexy. From here we go to what we call a vertical lift or vertical mastopexy. And this is an incision around the areola, and incision all the way straight down to the crease. We take out some skin around the areola and skin on the breast tissue itself. We actually bring the pillars of the breast together so it pushes the breast up, and this gives an actual breast lifting procedure. It not only lifts the areolar nipple complex, but it lifts the breast tissue up to a higher point. This can be done with a breast implant as well. From here we go to what we call an anchor mastopexy, where just like the vertical, we have an incision around the areola, one straight down to the crease, but now we have one, a longer one in the crease itself. We can take out some of the height of the breast so that if the breast is really long, we can shorten the breast a little bit with that technique as well. So we have all these methods that we can use for a breast lift. A lot of it depends upon how low you are when you start and how high you are when we finish. From here we go to the abdomen, and we do what we call an abdominoplasty or a tummy tuck. We can do this along with tightening the muscles, or we don't necessarily have to tighten the muscles. The incision is usually from hip to hip. It's long down at the level of the pubic area, and normally we can take out all the skin from the top of the pubic area all the way up to, or even a little bit above, the belly button or umbilicus, so that any stretch mark or any scars that are in that area are gone. And a lot of times women will come in with vertical scars from their belly button to their pubic area, and we can get rid of most of that scar at the same time. Depending upon how much loose skin somebody has, depends upon how far lateral or out to the sides the incision goes. The more skin we take out, the farther or the longer the incision is. We normally lift the pubic area a little bit at the same time. It usually gets a little bit saggy in all this process, but we get things much tighter, back closer to your pre-pregnancy look. Normally this is combined with liposuction. The upper part of the abdomen, if you look, is usually a little thicker than the lower part, and so we need to thin that area down a little bit. We need to thin along the sides, or what we call the flanks, And usually most women need a little liposuction along the hips as well, because as we bring this abdominoplasty in, the corners can push out a little bit, but if we do liposuction, the corners don't, we get rid of that push out effect that we otherwise would get. Areas that we frequently combine with this are the inner thighs, outer thighs if they need it, and the lower back, or sometimes even the upper back. We can do the arms as well. A lot of times women will want some liposuction of the lower cheeks and neck, and we usually will do this at a separate time from the mommy makeover, just for the length of surgery and for strategic planning in the operating room. But the end result is a great thing. We use a pain pump at surgery with the abdominoplasty. We use a pain pump with the breast if we do a breast augmentation at the same time. But it doesn't really hurt very much. The recovery is very fast. If we do muscle repair, the recovery is perhaps in 2 weeks. If we don't do a muscle repair, it's perhaps a week.